So one of the kind of real thing that's come from clinical and epidemiology research in the past year or so, this is one example by Evan Dellin, who's in North Carolina. But first we need to know the problem, right? How much money this requires to get new treatments, new diagnostics pushed forward. So part of what we need to do is to convince the people with a lot of money, which are the pharmaceutical companies, right? They're like the big grants, that this is important. And so one thing that's been able to happen, and because of work that the APFED has done to create ICD-9 codes that allow physicians to actually say that a patient has eosinophilic esophagitis, we now can query who has EoE, how many people have EoE. And so this is work that's showing that while the disease is still, this is for EoE specifically, while it's still technically considered a rare disorder, it's really not as rare as we think it is, and that it's becoming more prevalent. And so this is really showing that the prevalence, the cases per 100,000, this is in the United States, and this was done through insurance companies. So these are private insured patients. Ranging from kind of toddlerhood to infancy all the way up to 65, so not Medicaid patients. And what we see is that there are over 100 young men per 100,000 in the United States who have eosinophilic esophagitis. So while still considered a rare disease, it is more common and deserves attention.